in a moment. Okay. So what we are going to talk about this evening is the back to school season. And we're going to do that from 3 different perspectives. We're going to talk about it from an administrator side. So as a director, as the owner, what should you have in place to get ready for this back to school season? And then we're also going to do the opposite of that. How do we help our children get ready for this back to school transition? Because, we know transitions are hard on us as adults, so we want to help our kids get prepared as well. And then lastly, we're also going to talk about navigating COVID, but not only that, just illnesses in general when it comes to this back to school season, because we know once children go out into the public schools and then they come back to your program, that's a lot of, possible exposure that could happen, and a multi-ground of, maybe 5 different schools, and now they're all back in one. And so there's a lot of possibility for that. Contact and everything like that. So we're going to have our nurses kind of talk about some mitigation strategies and things that you can do from there. But then before we let you go for the evening, we will give you guys an opportunity to ask any questions, or if you want to connect offline, we'll be more than happy to do that as well. But with that, no further ado, I will turn it over to Miss Mary, and she's going to get us started with talking about the back to school season from the admin perspective. So Miss Mary, please take it away for us.
Well, hi, everybody. Thank you, Miss Heather, for the introduction. I am going to start with the basics. So school age program, you see on the slide there that the definition of it is to promote the social and physical, educational, emotional growth of all children in a safe, caring, structured environment. So there's a little bit more to that I'll add. So school age programs, they typically provide childcare during the before and after school hours. They may also offer care during school holidays and summer breaks. Different options for school age care may exist in your community. So local schools make contract with an outside provider, such as the YMCA or Boys and Girls Club, to offer this type of care. So there's a lot of different options out there where school age children are concerned, and providing care for them in the hours that they need it. So some family child care providers and child care centers also offer school age care. Other programs such as parks and recreation departments, community-based programs, and churches may also offer this type of care as well. So many current events, such as the COVID-19 pandemic, among other concerns that we all see, make it necessary for programs to follow the most up-to-date health and safety guidelines from agencies such as the CDC, KDHE, and our local health departments give some great guidance as well. But the CCHC network is here to help programs prepare to open their doors and welcome back school-age children and their families by using strategies to ensure smooth transitions and happy, healthy school year. The first part of administration practices that we can support, we want to take a look at policies. We have some bullet points there of some very important topics within policies that we can help address that you might want to take a look at. Really the basis of all of this is strong communication. So communication is key in the administrative piece of quality childcare. So developing clear and comprehensive policies is really a must. The CCHC team can support you in developing and updating policy and procedure manuals, parent handbooks, and contracts, keeping those up to date as times change. Just keeps you on top of any trouble that might arise out of that. So some examples you can see here on the screen, but there's a lot of a lot of areas where we can offer assistance. Our consultants can work with you on safety for indoor and outdoor activities and learning, staff expectations and guidelines, medication administration, media use and publication permissions, something that should be in your policies and procedures. Establishing hand washing procedures, illness and exclusion policies is an important one to have. Significant incident response and just general health and safety best practices to protect your business, and have a reference for how you're going to respond in different situations. Sharing that information with families that you're working with is vital to making sure that your program runs as smoothly as possible. So one thing to keep in mind is that many policies in childcare are quite different than the policies that children and families will find, say, in public school district. So it's good to be able to explain the difference and be able to help them navigate the transition from one to the other. Can definitely create some strife when you're working with a public school that has one set. COVID, for example, they have one set of policies there. They come to childcare and they're going to have some other rules to try and adapt to as well. So lots of areas in policy and procedure where we can support. A lot of things to think about when it comes to that, but contracts, parent handbooks, and policy and procedures are definitely areas that your consultant can help you in developing and implementing. So we have some looking at the point of view from parents and how we can help your support in that area. You know, sometimes dealing with parents can go smoothly, and sometimes it can go not so smoothly. So for we can help with difficult conversations and help you set some guidelines on how that should flow, how you would like those situations to be addressed, and what to do if things don't go so well. But again, keeping that open communication is going to help with that. So state some clear and direct explanations. That's the best way to avoid misinterpretation of your policies. So just keep it simple. That's usually the best case scenario, but you want to make sure that you're keeping all the details in there as well. You don't want to gloss over anything. So in addition to the parent handbook and contract revisions that I mentioned before, health consultants can help you update all the documentation that will be sent or given to parents. So if you have forms that are a little outdated, that's something that we can help you modify to fit your needs, and find some templates for something that may suit a change that has happened within your program, just to keep you current. So your consultant is also a great resource for handouts to help open an uncomfortable conversation with families. Well, I think we've all faced those in our careers. Some topics are easier to talk about than others. So opening that conversation can be a little bit difficult sometimes, but we can help with that. Families often look to their providers for child care for outside or community resources. So having a resource list for things like storm shelters, food pantries, child-focused programming in the communities, things like that, that can be very helpful for many families that you work with. Another great way to communicate with families is through a monthly newsletter. It keeps families informed of their child's activities in your program, what your program offers, any changes that may be coming about. And it's also a great way to share information like additions to your resource lists. So we can help support you in the administrative piece of staffing as well. So to have a successful staff, they have to be connected and aware of what's happening around them. And as administrators, that's our role to make sure that that's happening. an employee or staff member that's in the dark, is frustrated and not doing 100% as they would like to be. So just keeping them informed, and again, communication coming in. We just want to open those communication lines up, make sure they're receiving all the information that you want them to have. So one good rule of thumb is throughout the first 3 weeks of school, it's important to state the rules, review the employee manual if you have one of those, your policy and procedure manual. Note any changes that you want them to be aware of. Excuse me. And just review those things over the first 3 weeks. Include written policies and review those items as well. Some of the things that could be included are staff wellness and self-care, continued education, how they will work with transitioning students, some of the expectations there, and teacher and school programs, just kind of what your school's mission and is, and how you want things, the big picture of how you want things to go. So working with your staff is a key in this to making sure everyone's on the same page and they know what's expected of them. They know what you want to see happen, and then that helps them guide the children and families as well when they're working with them. So it takes weeks to create a habit, and our policies and procedures really should be habits. That's kind of our goal. So that 3 weeks kind of sets that up for success by just continuing to review those things through the beginning of the year. We can also help support you in supporting your staff. So when it does come to continued education, we can help with attaining those required training hours. We can help them when they're facing challenging behaviors, and social emotional learning is a great way for us to support you in supporting your teachers, and just making sure that things are organized and running smoothly is awfully important when it comes to things like that. So to summarize, keeping open lines of communication, not only with the children and families you're working with, but your staff as well. That will make your year smoother for all that are involved in your program. And your child care health consultant can help you with the administrative pieces to bring that all together.
Thank you, Miss Mary. And with that, we will move over we'll flip the script and we'll talk about how to help the children transition into the back to school. So I will turn it over to Miss Ashley, Chrissy, and Maddie.
Hi, everyone. So as I'm sure we all know, back to school time can be a little nerve-wracking for providers, staff, and students all alike. So it's really important to kind of be off to a good start. So these are just a few tips on little activities and things you can implement into a classroom that helps everyone start with their best foot forward. So I think introducing yourself, even if you already know some of the students or think that the students know each other, is so important, and having the students get to know each other in your after school program or before school program setting. So this can be done through icebreaker games such as a get to know you bingo, or smaller activities. One of my personal favorites is an all about me shirt. So everyone gets a piece of paper with an outline of a t-shirt and take some time to illustrate or create their own t-shirt that they feel represents them the best. And it's kind of really impressive the amount of different things the children come up with, and I also suggest you participate as well. And once everyone's done with their t-shirts, go around the class and share kind of what your inspiration was. Introducing students to classroom rules early is also super important. Involving students in this rulemaking process can really help them feel involved, and also they are more likely to remember these rules if they're participating in that process, and just understand the reasoning behind the rules a little bit better as well. So you could sit down in a group and have a conversation about what do we think will help keep us safe and keep each other safe? What can we do to keep all of us safe, but also make sure that we're all having fun in our time together, and write down all those ideas, as silly as they might be. And at the end of everyone's suggestions, take a vote on the top 5, which everyone feels are the most important, and make a poster. Everyone can also participate in that. Hang it up and just refer to it frequently. Like Mary said, habits, I mean, it takes some time to form them. So just revisiting as much as you can, and also modeling those rules. So maybe we have walking feet inside, and just mentioning that while you're doing it in those everyday interactions can really help as well. Defining the differences between school time and after school program time can also be really beneficial in just establishing that routine, and also establishing those rules, which may look a little bit different from classroom time or school time. So Ashley is going to tell us a little bit more about routines and schedules.
Yeah, so like Maddie said, I'm just kind of talk about how to create and develop routines and schedules to help prevent some of those frustrations that happen, especially at the beginning of the school year, like as the newness is happening and it's a new schedule. So one of the things that you can do is to develop consistency within your program, create a schedule and print it for have one for your mornings, like before school, one for your afternoons, for after school, and then also having like one for your days off, whether that be a scheduled day off, or if you take like weather days out or whatever. But you could sit down and talk with the kids about the different expectations and everything with those schedules and everything. And then another way to kind of help implement and prepare the kids is talk about some of the different transition activities that happen. So sit down with them and talk about various activities for daily transitions. So one of the biggest things that I remember when I was in a program with school age kids was in the morning before school, I'd ask them 6 times, do you want breakfast? No, I don't want breakfast. No, I don't want breakfast. No, I don't want breakfast. It's time to go to school. I want breakfast. We can't do that. We don't have time to give you breakfast because we have to get to school. And like, so sitting down and setting that expectation beforehand, it's not necessarily going to keep it from happening. Like it might still happen, but it's going to help give those kids that sense of independence and help them regulate. And I mean, it's one of those natural consequences. You can't let the other kids be late for school. So it happened to me all the time. So, and then asking for their feedback too is really important. So sit down and talk to, don't just say, I need you to do this and do this and do this by this time, and this is why. Ask them, why is it important that we do this? Why is it important that we make sure we eat breakfast in a timely manner? Why is it important that we make sure we have our backpacks together in the morning? And then same thing for like after school. a lot of families have the expectation for after school programs to have the children get their homework done. And that can be a lot, but if the kids know this time is set aside for homework and then this time set aside for doing whatever kids want to do, because they're school age kids and they want to do their own thing, but it's important to have that expectation set right at the beginning so that they don't come in, I don't know, a week into it and all of a sudden you were being lax in the beginning and everything was kind of cool because it's new and everything, and then now all of a sudden they're expected to spend 45 minutes on homework every day. So just kind of talking to them and also like asking them why it's important to do it here, because otherwise like a lot of them go home at the end of the day and have dinner and then they have, sometimes it's time for bed. Like, I don't know, my kids go to bed at 7:30, so it just kind of depends. But if you don't get home till 6 o'clock and then you eat dinner and then you get cleaned up and everything, you're not going to have time to do homework. Or if you do have time to do homework, you're not going to have time to just kind of hang out and relax and whatever. And kids need that time too. So having them know that there is an expectation for them to get their homework done while they're at your program can help avoid some of that conflict that is probably still going to happen, but it might prevent some of it from happening. And then another thing that you could do is, so a lot of kids struggle with transition activities. And school, like, it's really hard when kids struggle with transition activities and they're in that before and after school program that is somewhere other than school, because that's a lot of different here to here to here to here to here. And so something that you could do would be to print like a miniature version of what their like schedule is. Like, this is what we do from in the mornings. This is what we do in the afternoons. This is what we do on the days that you're here all day or whatever, so that they know what to expect and they can have that for themselves. Because some kids do have a harder time with that. Just knowing what's coming next and having that little book that they can just flip and see, hey, that's what's next. And that can help them. And then another really important thing to cover, this does not apply to everyone, but a lot of after school programs drive buses or vans. And so Chrissy is going to talk about a lot of different things revolving around that.
Yes, hello everyone. Yes, I am going to talk about bus or van safety and how you can kind of include the children on the rules and reviewing the rules with them. So kind of like Ashley already said, you really want to allow the children to be a part of this process. Sit down and just have a conversation with them. You might say something like, with school about to start, we'll be riding the bus or the van again. And what are some ways we can make sure we all stay safe? Stay safe. Look, that was a mouthful, sorry. And then just try when you're coming up with these rules. Of course, you could have a poster board and be writing everything down, the kids' thoughts and ideas. Just try to use positive wording. An example might be, while we're on the bus or van, we use inside voices. I know one thing when I started out in early childhood, it was drilled into me. You tell children what you want them to do, not what they cannot do. Makes sense. I mean, if you tell me what I can do, I'm going to do it, right? Anyways, after you and the children have the rules written out, you can let them know that maybe you want to type it up into a contract and they can share it with their families and, kind of give them that responsibility and that, I don't know, the fun of, hey, I made this contract at school and this is what it says and this is what we're going to do, to kind of include them and their families. And then you could have them sign it and put it away. And then of course have the safety contract posted where the children can see it daily, just that visual reminder like, hey, you created this contract. Remember, this is how we act on the bus. And then for fun, you might have the children act out what it will look like. What will the first day on the bus or van look like? And how do we act on the bus or van? I know I always liked acting things out when I was younger. And then if possible, I know creating jobs for the children to do on the bus or van is always helpful. I know it's not always possible for everyone, but you could have somebody help you take attendance. And then most importantly, just have fun with this process and make connections with the children. Children are less likely to act out under the supervision of someone they feel connected to. Now, I'm not going to promise that the children are all going to be angels all the time, 100% on the bus, because they're little humans. And I don't know about you, but I cannot always control my emotions, especially early in the morning. I do not like mornings, not a morning person. So, but just try to have fun. Give them some grace, you know. It's hard being a little human sometimes. On to the bus activities. So before I get into this, I do want to throw a disclaimer in here. If you know having items on the bus or the van will cause conflict, this may not be right for you. Or maybe you just don't have the space on the bus or the van. Please, by all means, don't do any of these. Safety is #1 priority. So I just wanted to throw that disclaimer out there. But I have seen some great ideas, and I've actually known a few providers that they have mini clipboards with paper on them and some writing utensils tied to the clipboard so that kids can set and draw to kind of keep them entertained on the way to and from school. Or maybe you can have a basket of books on the bus or the van so children can grab a book as they get on, or maybe you can incorporate that and make that someone's job to help pass out a book or put the book away, depending on if you have time. Like I said, this may not work for everyone. For those of you that it's not going to work, you can play a few games with the children before getting on the bus or the van, like an alphabet game. You could play, start with the letter A. Can you find items around that start with the letter A? Or maybe I'm going to play I Spy. I spy something yellow. That's always a great game to play. And then this way, when the kids get on the bus or the van, they have some ideas of some games that they can play with their friends. Doesn't require any materials, no hassle there. Because I know you're not always going to be able to play the game with them. Hopefully you're focused on driving. But again, just having conversations with the kids. Maybe before getting on the bus, you ask them, hey, what do you plan on doing on the bus or van on the way to school? And just keeping those conversations going. That was all the tips and tricks I had.
Well, thank you, Miss Chrissy. I loved some of the humor in there, because we know kids, we say it's going to work, and then kids will be kids and they give us curveballs. But before we switch it over and kind of focus from, the medical side and the illness and everything, I just want to kind of, share that with what all of the ladies have set up to this point. Practice is going to be key. And I think it's important to acknowledge that, implementing something new or trying something new with kids is not going to necessarily pick up on day one, or it could be great on day one and horrible on day two, because kids will be kids and it changes all the time. So, but I think if you're consistent and you practice, especially when it comes to, the safety on the bus and everything like that, it does get easier in time. And if it doesn't, you got us. Just give us a call and we'll help you navigate it. But with that, we will kind of switch gears a little bit and we will turn it over to Miss Erica and Miss Jessica, and they're going to talk about how we can navigate COVID with this back to school season rolling out.
Yes, thank you. So first, we're just going to touch on a quick kind of agenda for our own session. We're going to discuss, decision-making considerations, because every after-school program is different. You guys have different resources. You're located in different counties with different guidance. You have different populations that you serve. You have different, incomes and different histories and experiences. So there's a lot of, we're going to offer suggestions, but then there's a lot of just decision-making considerations to think about when making these decisions individualized for your own program.
And so with that in mind, we're going to offer some specific examples of how you might mitigate the spread of COVID and, disease in general. But I know the focus right now is on COVID with the spread being so high recently. We're hitting another wave. So it's definitely something to be aware of. And then lastly, what to do when someone, hopefully not, but unfortunately it might be inevitable, when someone tests positive or maybe their mom tests positive and they've been exposed, having something prepared so that when that situation arises, you're not caught off guard and struggling that's on a Saturday to find somebody you can get in contact with, just being prepared for the worst and hoping for the best.
Thank you, Jessica. We can advance to the next slide. And I wish we had more time with you all. Please just know that this is a general overview of suggestions that we're making here. If you have more in-depth questions, we really would love to meet with you one-on-one or, communicate via email if something comes up that we don't cover. We did want to highlight the topic of decision-making considerations because it's a big piece with navigating COVID. And so as Jessica mentioned, the first thing that you will need to do is determine what is the risk of COVID. This is going to be county by county basis. Some of you may have had the opportunity to navigate to the CDC's community transmission level map. If you've not, I'm going to do kind of a brief explanation of it. And then please also note that at the end of Jessica and I's slides, we have included a QR code that you can scan so you can have access to all of the resources that we reference in our presentation. We've also, in case scanning a QR code is not available to you, included a bit.ly. So if you take a picture of or write down that web address, you'll be able to navigate there and find links to all the resources that we reference. So the community transmission level is actually determined by the Centers for Disease Control based on 3 factors. What they're looking at in your county is the new hospitalizations that have occurred in the past 7 days, the new COVID cases that have occurred in the past 7 days, and then the percent of staffed inpatient beds that are occupied by COVID patients. Once they have calculated that, they'll assign your county a community transmission level, which is either going to be low, medium, or high. And so you can then take that information to use a chart that the CDC has developed with specific recommendations for your community transmission level. When you're looking at the community transmission levels, one of the biggest differences you'll note is that when you go from a medium to a high level transmission, the recommendation at high level transmission is universal masking, and that's for community settings as well as the K through 12 setting. So once you've figured out what your community transmission level is, you're looking at the recommendations. They've broken it down into what you can do as an individual or in your household, and also what you can be doing as community mitigation measures. So as a staff member or a director of a school age program, you're going to be focused more so on those community mitigation measures that can be taken, such as masking and things of that nature. We're also, with decision-making considerations, asking ourselves what resources are available to me. It's, again, going to be unique to your area. It's going to be unique to your facility. So one resource is square footage. How much space do you have in your building? What's available to you there? Do you have the ability to spread kids out, to physically distance them? Do you have the equipment to do that? At snack time, do you have enough tables where you could actually put children into smaller groups so that they, have that physical distancing during those times? Another great example as far as resources would be, if you've got a small transportation van versus a bus, and you have the financial means to be able to use that bus so that you can put that smaller group of children more spaced out in a bus, that's an option you could potentially look at if it's available to you. Last resource I wanted to talk about, some health departments and pharmacies are offering free COVID tests. So if your program is wanting to participate in a test to stay program, or you want to have those available for your patrons, that's something to look into as well. And lastly, we haven't mentioned, is this decision equitable? Decisions that are made as a whole should not disproportionately affect a certain group of people. For example, those who are located in the rural areas, disabled, immigrants, the Black community, Hispanic individuals, and Native Americans. Another thing to take into consideration is your own staff. So if you have a worker who wants to take extra precautions to protect themselves, especially those who are immunocompromised or may get very sick with COVID-19, say it's a low community transmission level and that staff member still wants to mask, just supporting them in those types of decisions. Another example would be at the health department and early childhood education level, the decision to put in place strategies like screening, testing, and contact tracing should be made in such a way to ensure the same resources are provided to all within that district and that community. And we can advance to the next slide and pass it back to Jessica.
All right, so we've got some specific examples of different things that you can implement in your program to help mitigate spread. I'm sure a lot of you guys did daily health screenings back when it was high and spread was really high, and maybe you haven't done those recently. It's always a good idea to keep an eye on your children. If they're showing signs and symptoms, that would mean that they need to be sent home. But another one of those things that's really recommended when your county reaches that high level of transmission again is implementing those daily health screenings. So checking the children's temperature, just giving them a quick once over, making sure they don't have any symptoms. And then, asking the child or their parents, if they've been exposed, or, just having that communication of, hey, if something happens at home, if you find out you've been exposed, I need to know immediately so I can make the best accommodations for you guys. Having that communication with parents so that maybe, they can inform you when those situations arise. Again, like Erica said, when the county transmission level is high, it's recommended to mask indoors, bringing back those masks. I know that's really hard, but unfortunately, it is just something that we have to do when spread's really high to help protect each other, especially if you don't have the resources to spread out, if you don't have the resources to do activities outside, or if you're on a bus or a van and people are sitting close to each other. You're bringing multiple children, maybe from different schools and different exposure places, all in one small room. Masking is a great resource to just help mitigate that, so that if somebody does test positive, then you don't have to exclude every single child from the program. You can mitigate the spread, you can identify it and isolate it and keep your business running. Hand washing, obviously, you guys have hand washing procedures in place, I'm sure, but maybe we're encouraging hand washing when the child arrives to the center after school, and implementing that with more frequency, or, providing sanitizers in easily accessible places. All children over the age of 6 months can be vaccinated. So something that you can do is you can encourage vaccination by providing information to parents. If you need handouts or if you need resources and information to do this, we are a great resource for that. We wrote an article and we have all these resources for you to give parents if they're asking questions, or maybe you just want to communicate that this is an option for their child, and it can help the center as well if there is, someone coming in who's tested positive. Tracking vaccine status, you should be tracking children's vaccinations anyways. So then, maybe you add COVID vaccine to that, being aware of what child has been vaccinated, so that if they've been exposed to someone who tests positive, that affects their isolation guidelines. So it's important to be aware of what children have been vaccinated. And then maybe you partner with your county health department and they come and offer, well child or COVID vaccinations during the program hours, since, mom and dad are working and maybe they can't get the kiddo to get vaccinated during business hours. Another thing would be cohorting. keeping children in smaller groups, smaller class sizes, doing assigned seating. If there has been exposure, keeping the children who have all been exposed together and separated from the rest of the facility. You can cohort, in the facility in different classrooms and all of that, but you can also cohort on buses. If you have multiple vans that you're sending out or buses or whatever, keeping it consistent with the same children being exposed to the same children will just help if a situation does arise where you need to track if someone's been exposed. Obviously, cleaning is great, having a daily cleaning schedule, having it posted somewhere and communicating that with staff. Cleaning your transportation method, bus or van, cleaning that once a day is maybe something that we don't think about, but that can also be a good disease prevention measure. Again, assigned seating indoors and on the transportation. And then just looking at non-indoor alternatives. So what can you do outside? Is the weather nice? Can we go outside? How can you communicate with parents about what's going on in the facility? Do you have a social media post that you account to or newsletters that you share information? Just thinking outside the box and being creative of how we can safely distance ourselves or do activities that aren't in a confined space. And again, policy writing, I'm sure you have an illness policy, but does that illness policy include COVID? Because guidelines change and maybe that hasn't been updated for a few months. And now with this new rise in cases, you're wondering if the guidelines are still the same. So looking at your policy and making sure that it accurately reflects current recommendations, and then also accurately reflects what you want to do and how you want to respond when someone either tests positive or has been exposed. And then again, just looking at transportation options. If you do have a bus and a van, opting for the one that you can more social distance on, or maybe if you have multiple vans and you can fit all the child on both vans, but you choose to use all the children on one van, but you choose to use both vans for transportation to again, promote distancing, cleaning those areas, masking and transportation, and then cohorting, keeping the same children on the buses and vans.
Thank you, Jessica. Are we ready to move on to the next slide? Perfect. I am going to try to get through this quickly here. I so appreciate your guys' attention. This is a lot to listen to and sit through. A really great comment came through in the chat, just talking about how there are differences in the counties and what they require and their different mitigation strategies. And that is true. I just wanted to put the reminder out that Jessica and I created this presentation based off Centers for Disease Control and Prevention guidance, but do know that the state considerations are to be taken in as well. Normally, what KDHE says aligns pretty closely with what CDC says. And then when you get down to your local health department level, that's where you may start to see those differences, because each county is taking a unique approach to COVID depending upon what circumstance they're in with the community transmission level. So great point there in the chat. And I know that that does get really tough to keep it all straight. And to that point, I would say what to do when someone tests positive has also changed a little bit. For some of you providers, this may not be your first school year dealing with COVID, but we have had some changes as far as who can get vaccinated and what that means for your population. So anybody who tests positive is going to have to be excluded, but not everyone who has been exposed is necessarily going to have to be excluded, especially if I'm insinuating if they've been vaccinated. And we'll go over that here in just a minute. But you do want to let your local health department know if you've had a positive case, and they can help you with some of those more involved questions, like, do you need to totally shut down a facility or totally shut down a classroom? Can we cohort those children who are exposed that aren't having symptoms? Our recommendation is always to lean on them for that guidance. Communicating to the parents, of course, if there's been some sort of exposure in your facility, using means such as a phone call, an email, or a letter sent home to those families. The one thing that has not changed is the exposure definition. So that's still a cumulative 15 minutes in a 24-hour period at distances less than 6 feet. That would constitute an exposure definition. I will say that when universal masking is in place, the K through 12 exception to the close contact definition can be applied. So what does that mean? Well, this says that close contact definition excludes students who are between 3 to 6 feet of an infected student if both that infected student and the exposed student correctly and consistently wore well-fitting masks the entire time. Some schools may also still be using a test to stay program to keep those quarantined students who have negative test results in that classroom environment. Any positive individual is going to be excluded for 5 days. If their symptoms are getting better or they've resolved and they've been fever-free for 24 hours, they can return, but only if they can mask correctly and consistently for the additional 5 days. If exposed, an individual may be excluded for 5 days and then return to program if they are symptom-free and again, able to consistently mask for 5 days after that. If that individual is vaccinated, so that's 2 weeks past their 2-dose series, or if they are eligible for a booster, and they're symptom-free, they may not have to be excluded and could mask for 10 days, the full 10 days. We have a resource for you guys. That was just a lot of language I threw out at you, but there's a CDC isolation and quarantine flow chart. And it's a really easy on the eyes tool to kind of figure out what steps to take. So that'll be available if you scan the QR code and use the bit.ly. And then the other tool that we thought you all might find really helpful is the CDC quarantine and isolation calculator. So we have linked that on this next slide here too, and we can go ahead and go to that slide. And as I said, there is just so much information and so many unique and individual situations. So please feel free to reach out to us. And if we don't know the answer, we will reach out to someone to get that correct answer for you.
All right, well, thank you, Miss Erica and Miss Jessica. Well, with these last couple minutes, we really just wanted to open it up to the providers and see if they had any specific questions they wanted to ask, or if they, want to talk one-on-one offline, that's more than welcome as well. So if anybody has any questions, we can answer them now. All right, well, somebody
I
started.
saw in the chat that one of the folks that joined us asked about basic policies. So it's probably something that I said in on my slides, just kind of generalizing general policies and procedures. So if anybody wants to kind of contribute to what might be considered general policies and procedures. To me, that's things like your hours of operation, that you feed the children while they're there, that you change their diapers. To me, those are general policies and procedures. But if any of the other team members want to jump in on what they consider general policies and procedures, that might give that provider more information.
I would definitely agree with that, Mary. And when I think of general, I think of everything that you need to do to run your business from A to Z. So there's a lot that can go into that. Of course, this focus that we want to hit on is school age. But there are a lot of policies that go in from the time your school agers there till the time they leave and come back and all that kind of stuff. So yes, I would definitely agree with that. It's the everything in between from the open to close shows that you do and, kind of guides you with that. But unless anybody else has any other questions, I just want to thank you all for tuning in with us tonight. And then just thank you in general for everything that you do every single day. All of us on the CCHC team, we, understand what it's like, working in the early childcare field. And we definitely, you guys don't hear thank you enough. So thank you from all of us. We will be recording this so you can, or it is recorded. But we will be sending this out. So if you want to reference anything, but we wish you the best of luck in navigating the back to school season. And if you do need anything, please don't hesitate to reach out to us. Have a great evening, everyone.